professor and classmates. My name is Pratikcha Chan. Today I will be presenting a case for a 16 years old with the woman's health problem. For the patient's information, initial for the patient is TP, date of birth 27/2008, 16 years old, Cajun female. She was accompanied, she just got her driver license, so she was excited to drive. She drove to the clinic, but her mom was sitting next to her car, and then her mom is waiting for her in the parking lot. She came to the clinic like in the office by herself. For the chief complaint, she was here for a routine follow-up for her positive HPV, which was detected a week ago while she was doing her well childless visit. For the HPI, the patient is a 16 years old female who presented for a follow-up visit after her positive HPV test during her routine pap smear. For the annual exam, she is asymptomatic and denies any genital warts, abnormal vaginal discharge, or pelvic pain. She expressed concern about the diagnosis and its implication for her health and her future fertility. She was a little bit of anxious and nervous. For her medical history, she started her menarche at the age of 12. She is having her regular menstrual cycle with a regular flow, no denies any heavy bleeding. She's sexually active for the past year, uses condoms but inconsistently, not consistent, and no any other history of sexually transmitted disease or any prior abnormal pap test. Her last period was 2 weeks ago with a normal flow. For the allergy history, she does not have any non-drug allergy. For the medication, she does not take any medication. For the immunization history, she has taken 2 doses of HPV, the Gardasil 9 vaccine, and her third dose is pending. She is up to date with other childhood vaccination, including flu for this year. Regarding the family history, her mom has the history of cervical dysplasia and no other family history of any other cancers are related to her diagnosis. For the social history, she lives with her parents. She's a high school student. She's sexually active but only with one partner, using condom inconsistently. She does not drink alcohol and denies doing any drug use or any illicit drug use or any tobacco use. For the objective history, her blood pressure today in the clinic was 110/70, her heart rate was 72, respiration 16, temperature 98.4, and her BMI was 22.5. For the physical examination, for general, she was well appearing, alert, no distress, like little bit of nervousness, but not in like a huge acute distress. For HENT, normal, no lymphadenopathy. For abdominal, no tenderness, soft, no masses. For the pelvic exam, her external genitalia was normal, cervix appears to be normal, no visible lesion, warts or discharge, and no cervical motion or tenderness. For the skin, no lesion or rashes. For lymphatic, no inguinal lymphadenopathy. And for the diagnosis, we did a pap smear. Pap smear was done on a well exam, which was like last week, and then we positive result for HPV, but we are still pending the result for cystology to assess for dysplasia. Her HPV typing was taken, it was positive, which means high risk for HPV, and colposcopy is not indicated at this time. We're still waiting for like pap smear result. Once the pap is out, and then if we need to do the colposcopy, we will do the colposcopy. And for differential diagnosis, her differential diagnosis will be like cervical HPV infection. She is asymptomatic, and it can be confirmed by a positive HPV test. Another diagnosis can be genital warts, which is unlikely because she denies any lesion in and even the physical exam, during the physical exam it does not reveal any genital warts. The final diagnosis can be cervical dysplasia, uh, since has a history for a mom having a cervical dysplasia, and she's in risk due to high risk of HPV infection. It can, just the HPV has been positive at this time, we are still waiting for the pap smear result. So regarding the pap smear abnormalities, after the pap smear abnormalities, we can determine whether she has a cervical dysplasia. For the treatment option, no treatment required for asymptomatic HPV infection at this time, since she does not have any symptoms. We are not going for any treatments. So just encourage the patient for the completion of final dose of HPV vaccine in 6 months, like the third dose, to provide a full protection against the multiple strain, including high risk associated with cervical cancer. For the patient education, just educate the patients regarding the importance of regular follow-up, pap smear to monitor any abnormal changes in the cervix, reassure that the HPV infection does not mean immediate progression to cancer, but it emphasizes the importance of completing the HPV vaccine series and practicing safe sex. Advising the patient on the use of condoms to reduce the risk of further STI transmission and reduce the risk for spreading HPV to the sexual partner. For the follow-up, she can return to the clinic in 6 months for a repeat pap smear or sooner if she develops any symptoms such as abdominal, vaginal bleeding, pelvic pain, or any visible lesion. If the pap results come out with like an abnormal cell, we should consider doing a colposcopy for further evaluation. And other patient education include like safe sex counseling, using importance of using condoms consistently to prevent the HPV transmission and other sexually transmitted infection, to provide emotional support, like provide reassurance that her fertility and overall health are not at immediate risk at this time, and then discuss about like a high likelihood of clearing the HPV in youth and healthy individual. And mental health, like I'm sure after knowing this, her mental health has been disturbed or interrupted, so we can offer a referral for a mental health counseling if she is overwhelmed by this diagnosis. And then since she was seen a little bit of anxious during the physical examination. And I will list the reference on the discussion board. Thank you.